Welcome back to Dr. R. I'm here with Dr. Mitch Abrahams, and we're going to be talking about kidney stones. Dr. Abrahams, what are kidney stones?
Well, kidney stones are crystal structures that form in the urinary tract, part of the kidney. And as anybody who's tried the past one will tell you, probably one of the most painful medical conditions out there.
And how common are they?
Very, very common, unfortunately. It's estimated that somewhere between 10 and 15% of all Americans will at some time get a kidney stone. Very, very common problem.
Why do we get kidney stones? Why do they form?
Well, they form mostly because of salt that's in the urine that concentrates from not drinking enough fluids. So the most common cause of kidney stones is dehydration. And that's why people who live in warmer climates, such as here in Texas, get a lot more kidney stones than people who live up north. That they form based on 3 specific principles that are very well worked out. But it's interesting to note that the exact microscopic thing that starts the kidney stones is not known. So the first step is still unknown despite all the medical research. But we do understand the next 3 steps. Step number 2 is crystal formation. So what happens is the chemicals that are in the urine get concentrated enough that they come out of solution. Just like if you had sugar crystals in your iced tea and you don't stir it up, the crystals are just sitting there. So urinary tract crystals are a similar type of thing. Number 2, you have to have clumping. So if you just have crystals and you just wash them through the urinary tract, nothing happens bad. But if they clump together, that's when you start having a 3D structure that can cause trouble. And the fourth step, the third thing that we understand well, would be adherence. So that clumped crystal structure has to stick to the kidney so that it can grow to a big enough structure that it's going to cause trouble. So again, we don't really understand the first step, but the next 3 steps are pretty well worked out.
And so what are the risk factors that predispose somebody to getting kidney stones?
Well, the big thing is risk factors for not getting and staying hydrated. So living in a very warm climate, doing a lot of physical activity, people who exercise, runners, things like that, people whose jobs require them to be outside in the hot sun, landscape workers, factory workers, people who are sweating a lot is a big risk factor. Also, drinking a lot of caffeine and alcohol, which are both diuretics, that's a risk factor. We see 2 age groups that form kidney stones. People who are chronic kidney stone formers often start in their teens and 20s, and then there's sort of a time where not a lot of people get kidney stones. And then as you start getting into your 50s and 60s, we see another peak of people who start making kidney stones.
Does diet impact kidney stones, things that you eat?
Extremely, extremely important. Diet is the biggest factor for kidney stones. So basically the biggest thing is what you drink and how much you drink. Okay, a lot of us like soda, coffee, tea, and things like that, and all of those things are going to predispose you to stones. Now, the thing that will offset your risk for stones would be fluids, mostly things without caffeine, and specifically citric acid. So things like lemonade and things like that are good. Dietary factors are very, very important. Salt is a big factor, and we'll talk about maybe the details of that in a sec. But basically, eating a lot of salt, which a lot of us do, is a risk factor for kidney stones. Protein intake is a big factor for people making kidney stones. It turns out that a lot of times, for decades, people were told that calcium is a big problem. Since the stones are made out of calcium, the assumption was that if you eat too much calcium, you're going to make kidney stones, therefore avoiding calcium would be good. It turns out that was 180 degrees wrong. It turns out that if you avoid calcium, people actually make more calcium-type stones. So bottom line is intake of calcium is not the cause of most people's kidney stones.
And what are the different types of stones? How many are there?
There's lots of different types of stones, probably 20 or 30 in total. But the far majority of people have calcium-based stones, most commonly calcium oxalate. Oxalate is a chemical in foods that we eat. It's in foods that people consider pretty healthy. Spinach, black pepper, it's in bran flakes, things like that. It's also in some things not so healthy, chocolate, peanuts, things like that. So oxalate is also made by the liver. That's the most common type of kidney stone. Number 2 is calcium phosphate, or a combination of calcium oxalate and calcium phosphate. It's very, very common. And phosphate stones are thought to form with high protein intake. Urinary tract infections can cause those. Then we also see uric acid stones. Uric acid stones sort of number 3 in incidence. And those are caused by protein crystals that build up mostly for people who have gout, which is a problem with uric acid metabolism, and people who have very acidic urine will make uric acid stones. And then there's infection-based stones. That would be the next most common. So if you get a kidney infection, that can change the urine pH and form kidney stones. And then there's a lot of more rare types of kidney stones. There's inherited forms of kidney stones. There's medications that can turn into kidney stones. Those are much more uncommon.
And what are the signs and symptoms of a kidney stone?
Well, the most common presentation for a kidney stone is what we call kidney colic. Okay, colic is a very, very severe pain episode. Pain usually starts in the flank, which is sort of this area near the ribs, can come around to the lower belly area, can even go into the genital area, and it's an extreme pain in a lot of circumstances. Go into the emergency room, night or day kind of situation. There's a lot of times nausea and vomiting with that. Sometimes a fever. If there's an infection, or even if there isn't, you can have a fever. And blood in the urine would be the other common thing that people might see.
And how do you diagnose a stone? What's the best test?
Well, usually when somebody comes into the emergency room with a presumed stone, we'll check a urine test, and in the urine test we can look for blood. We can actually see the little microscopic crystals, which will hint to us that there's a stone there. And most commonly, we're going to do some x-ray test. The most common x-ray test now is CT scan or CAT scan. That's a three-dimensional imaging test of the entire belly cavity that'll show us kidney stones, kidney blockages. It shows us how big they are, where they are, how many there are, shows if both kidneys are affected, and so it's a very, very good imaging test.
And how do you treat kidney stones? What are the treatment options?
Well, a lot of kidney stones that are small will pass on their own. So sometimes what people just need is some help with medications, pain medicine, nausea medicine. Now we actually give medicine to help people improve their chances of passing stones. That's become common over the last 10 years or so. So we'll give a class of medicine called alpha blockers, Flomax, Uroxetrol, Rapaflo, one of those medicines, and that's shown to increase the chance of passing small ureter stones. If the stones are too big to pass, there's only one real type of stone that's actually dissolvable inside the body. That's uric acid stones. And so if somebody comes in and we diagnose uric acid stones, we'll give them medicine to dissolve that, assuming that they're not in a lot of pain and don't need surgery for that. If they have the most common type of stones, calcium stones, then we're usually going to have to do surgical therapy if they're too big to pass. Three main options. The most common is what we call shock wave lithotripsy. Developed in the mid to late 80s, non-invasive therapy, whereby a machine is brought behind the kidney and delivers very precise, very focused, large, high-energy sound waves. And the sound waves bounce off the stone, break them up, and then the patient passes the crystals. For stones that's not going to work for, we use what's called laser lithotripsy. So in the mid to late 90s, there was an invention called holmium laser that came out. And in order to get the laser to the stone, with the patient asleep, we put a fiber optic telescope up the urinary tract. We find the kidney stone, and we have a little tiny laser fiber, not much bigger in diameter than a human hair. We put the laser right to the stone, and that will break up any type of stone, no matter how hard it is. And then we retrieve the fragments after that. And for stones that are much too big to do that, we do surgery called percutaneous surgery, where we actually make a very small opening right into the kidney to be able to remove larger stones. And much more rare than that, we'll do robotic or laparoscopic surgery to remove large stones.
Well, that wraps up today's episode. Tune in next week for another exciting edition of Dr. R.